Hello, this is Jeff Usher with Kansas Health Foundation. Thanks for taking the time to listen to this webinar on Healthy Communities Initiative's semi-monthly activity tracking form. The purpose of this webinar is really for the Healthy Communities leadership teams to gain a clear understanding of how to complete the semi-monthly activity tracking form and why. It's been over a year and a half working on this initiative. And one of the things that has been clear is that there's been some communities that have had a hard time coming to a decision on what policy priority to pursue. So if we can take everyone back to one of the key frameworks that we're working on trying to move public policy at the local level is around the Kansas Civic Leadership Framework. Let me remind everyone around technical versus adaptive work. The work that we're trying to engage the communities and your leadership team in the 12 communities is really the work of adaptive work. And that's one of the reasons we are focusing on the policy or the environment. Clearly, often when we gather folks, and we've experienced this, and many of you can probably talk about this, we often gather folks, they always want to go to a technical fix to adaptive problem because it's the easy thing to do. So you'll hear things like, well, we just need to educate those parents. We just need to, it's usually individually focused, and it's often, we're getting some feedback here. Usually individual. Yeah, is it feedback? All right. So we're getting some feedback. Hopefully we'll slow down the conversation and maybe people will be able to hear me. So I want to remind people of the the difference between technical and adaptive work. The problem in a technical is always clear. In adaptive, it requires learning, and we've all known that this work in creating environments that make the healthy choice the easy choice is really adaptive. It requires more and more learning. The solutions aren't clear. We need to learn more about how the solutions are. The experts and the authority can't fix it for us. We have to engage stakeholders. Usually the type of work is efficient. It's pretty easily defined and people know what to do. Adaptive work requires smart experimentation. In technical work, it's an easy fix. Someone can do it. You can go to someone, they can fix it. In adaptive work, the expectation is, and this is something I want people to really understand, is that we start making progress on the issue. We don't expect you to fix it. We don't expect you to fix it within the 3 years of this grant timeline. So the timeline is not quick, which was always easy in a technical challenge. It's longer term. And what's required is not knowing exactly what to do, but the curiosity and making it happen. And again, one of the things that I think also distinguishes adaptive work with technical work is the notion that it is not focused on individual behavior change, but systems. How do we create the system and the environment that make the healthy choice the easy choice? And I know people are probably getting sick of me saying that, but that's what we're trying to do. So communities have been planning on how to intervene around the adaptive challenge of creating healthy environments for over a year now. Many of you have been successfully using the civic leadership competencies of diagnosing the situation, managing self, energizing others, and intervening skillfully. Communities have been in diagnosis for over a year in the planning phase. This implementation phase is really focused on intervening skillfully. And this requires the leadership team to be actively engaged in experimentation. So the activity tracking form itself and the work that we're doing here at the foundation and with our partners with Healthy Kids Challenge, Center for Community Support and Research, Public Health Law Center, and Innovation Network, all the communities out there, as well as our Kansas Advisory Committee, is really also an experiment in this work around how do we create healthy communities. Many of you have been engaged in some of our work prior in our nutrition and physical activity work. Several of the partners are the same partners. We've learned from that. That was an experiment. Out of that experiment, we kept learning. This is also an experiment in which we're trying to learn from our work and your work. So the activity tracking form is one way we are measuring progress on this initiative. We want it to be easy and hope to learn from this process. We are also collecting data externally that will help us learn how to support this work in the future, such as the TA team is working, and every time they have contact with the communities, we're tracking that information through a contact form that we do on SharePoint, so the TA team can all see that. So we're collecting data there. We're hearing great stories. We're seeing that things are happening out there. This particular activity around tracking the activity around policy priority is really about intentionally focused on experimenting around a policy priority. So we can go to the tracking form and we'll start talking. Elissa will kind of walk you through how to access the form, and then we'll talk a little bit more in depth. And I'll try to give some examples of each of the filling out the form as we go through. And I might add, if you have questions, still go ahead and ask those questions in the chat box. We'll start collecting those. And periodically, if it looks like it's relevant at the moment, we'll try to answer it. If it's not relevant and it's something we can answer at the end, we'll answer at the end. But we'll get all those questions answered.
Hi, I'm Elissa with the Kansas Health Foundation, and I'm just going to go over the online reporting form. So your first report that you'll complete will be due on September 15th, and we'll give you the link to get to the reporting form, and you might want to save that in your favorites on your internet browser, or we'll also have a link to it provided on SharePoint. What you're seeing right now is just going to be the sign-in page. And when you completed your proposals recently for the implementation phase, you also used this same sign-in page. So we're linking that reporting to your proposal. So the person that completed that online proposal might have your account. So if you want to change who's going to be completing the report, let us know who that email address needs to be set up with so we can get that changed in our system. So if you just want to shoot one of us an email and let us know who's completing your reports, we kind of like the same person doing that consistently. So let us know if that needs to be changed. So today I'm just going to sign in with a dummy account just as we walk through the online form. So once I log in, it's going to take me to an applications page, which we're not doing an application. We're actually completing a report, which is one of your requirements. So we'll select the requirements link at the very top of the page. And underneath where it says new, you'll have a link where your report that needs to be submitted is going to be located under. So if I click on Healthy Communities Initiative Semi-Monthly Activity Tracking, it's going to take me to the report that needs to be submitted. The very first page is the cover page, and again, it's going to list out all of the due dates for your report, your semi-monthly report. And if you also want to know what those reports are, they are also provided in the grant agreement that you received a couple of weeks ago. It lists out all the due dates for all of your reports for this initiative. At the very top of the page, you can click to a different page. If you want to go to page 3, for instance, you click 3. We'll just go to the next page. And the first page that you'll be filling out is for your policy priority.
Yes, the policy priority is this is real important because I think there's been some confusion and a little anxiety with some of the healthy communities around choosing a policy priority. But if we take back to what I mentioned around the civic leadership activity around experimentation, this is really a means for you to decide on and experiment on a particular policy priority area. So it has to be specific. We've had conversations with a lot of communities who really are fearful of if they choose one policy priority, they lose the work on another, and that shouldn't be the case. We want you to work, if you have energy around complete streets and you have energy around work site wellness, do both of those. But for the reporting process for this experiment, we want you to focus on a policy priority, so it needs to be specific, and you don't lose any work on any of the other activity. We know that communities out there are doing lots of activities, and if you were to report on all the activity that you're doing, it would overwhelm you in this reporting process. So this is just a way to try to get communities to intentionally focus on a policy priority and using the community change framework to move that policy in your community. So it does need to be specific. It also needs to be approved by your leadership team and the TA providers. I say approved. The TA providers are just going to say, yeah, it would probably come to an agreement with you. So it needs to be an agreement with the leadership team and the providers. You should not have to ask permission from anyone else in your community because it's going to be the leadership team's work. So it's the members of your leadership team make the decision on what the policy priority is. You shouldn't have to ask permission from the broader coalition. You shouldn't have to ask go out and pull the community. It's around. You already know. You've been working for a year and a half. You know there's been energy around this policy priority area. We just want you to start acting on it. So the other thing is the policy priority may and it probably should change over the course of the 3-year initiative. We'll be learning from this. This form may change over the course of the 3-year initiative. Because as I said, this is an experiment. We're going to be learning from this process, and we're going to continue to try to collect the best data we possibly can. So looks like we do have a question already. September 15th is a Sunday. Is it due by 5 p.m. regardless of the weekend date, or is it due by 11:59 Sunday the 15th?
When we set up these dates, we wanted to make it consistently due on the 15th so it would be easy to remember. So if you can get it done before the 15th, that would probably be the best because your reporting will give you the dates of what your information is covering. So the September 15th, the due date, is actually covering the reporting period of July 1st through August, the end of August. So you should have all of that data. So we really would like it by the September 15th deadline. So if you get it done like on the Thursday or Friday before, that would probably be the best thing.
Okay, we can move on.
The next page of the reporting is going to be on community partners and community mobilization.
So this report allows you to report activities conducted by your community partners and coalition members. So the notion is we want to measure how you are engaging with others and mobilizing others. So the activity we want you to report on is not the work that the community leadership team is actually doing, but your partners and the broader community. So other coalition members that aren't on the community, so that the reason we want that is that basically you're going to be doing some type of activity in engaging these folks, which you will report on in other places in this form. But what we really want you to report on is who might be acting on your work. So we got a few examples that I can go ahead and just try to fill out here. So we asked our partners to give us some scenarios. So hopefully this will be helpful. So one of them is, let's just say above we said safe routes to school. So the community partner that we engaged is Sam James, Superintendent, USD 1011. And what we did, or what they did, was they advocated with an organizational decision maker. So somehow, this isn't a member of the leadership team. Sam is, he may be a coalition member, he may be a member of the community, but somehow the leadership team has engaged Sam James, superintendent of USD 1011, in their work. It could be through a meeting, individual meeting. It could be through a convening around safe routes to school, which is the policy priority that would have been selected on this one. I neglected to say that. Say this is safe routes to school. So Sam was gathered by the leadership team in some fashion and educated or mobilized in some fashion. And then he met with the city engineer to discuss safety, school, so that would be an example of an activity around safe routes to school that you would report around community mobilization. We do have a question here. When identifying our priority area, as the form is completed, would active transportation policy be specific enough, or would we need to focus on specific active transportation policy? You can start out with active transportation policies, and that would be okay, at least at first with this first reporting period. The Public Health Law Center may help you narrow down more specifically a policy that might help your community really move active transportation. So that more specific policies can be determined later. So this would be okay, and you can continue to mobilize people around that. So I had an example that would be very similar to that. Another example, it would be, let's say it is, you chose active transportation. I used complete streets. It's basically the same. So I'm going to shift. We're doing complete streets or active transportation. So an example would be John Doe, the Executive Director of the Chamber of Commerce. And he educated government policymakers. And what he did was he met with the mayor to discuss the economic benefits of a walkable and bikeable community. I just made a decision. I'm not going to fill these out anymore. It's just a waste of time. What I'll do is walk through some specific examples. So that's another example. Any questions regarding that? So the idea was if it's active transportation, let's say the executive director of the chamber was invited by the coalition and that's later on as another example, to hear an expert on complete streets or active transportation. And this expert talks about the economic benefits of active transportation. And the executive director of the chamber says, that's what I do. I want economic development in my community, so I'm going to go to the mayor, and I'm going to go talk to the mayor, and I tell someone on the leadership team that. So that's another example of how you would fill this one out. So specifically on this particular item, the very first one on community mobilization, it doesn't record the activity of the leadership team member, but of a coalition member or someone else in the community. Okay, want to go on to the next?
There's on this page, there's up to 10 different activities that you can track. So as you go down, there's 10 spots to fill out.
And I might add, there's 10 spots. You don't have to fill 10 in. You're gonna, and my guess is as you do more and more work, the challenge may be not necessarily finding enough to. We don't need everything. You don't have to fill in everything. The idea is to give specific examples of the work that you're doing. And at the end of this webinar, I'm going to tell you I'm going to take off my Kansas Health Foundation hat and put on my leadership team hat of the Health and Wellness Coalition and give you a very specific example of something I think was a missed opportunity on our part. So so that's mobilizing community. So if you want to go to the next section, you just hit the next section, and you got community education. So this is going to allow you to report the extent to which your leadership team has engaged the media and also earned media successes that help build awareness and support actions related to policy priority. The earned media can result from action taken by the leadership team directly, community partners, coalition members, or other members of the public or community that are supportive. There's this particular area comes in two sections. The first section basically is kind of talking about what your leadership team activity was. So distributed materials, press release, letter to the editor, spoke directly with the reporter, news editor, publisher, station manager, etc., or activated partners to garner media and leadership on the leadership team's behalf. This can be done by a number of other opportunities. A lot of the opportunities that might come about is when you convene people around an area. Always engage, try to engage community reporters or people who can help you earn the media. So it's around creating opportunities to engage with and potentially create that opportunity. So to give you some examples of community education, go back to complete streets. Now, for complete streets, in the narrative box, I might say I invited a reporter, a city commissioner, business leaders to a presentation by a complete street expert. His name is Fred Walkalot. That was done on 6/19 of this year. And we discussed after the presentation, we discussed with the chamber exec and the daily news reporter, after the presentation. So basically, you're described. You created. You spoke directly with, and then you would describe what you did. So we had a presentation. We brought in someone. We invited the chamber. We invited the reporter. We invited others, probably some policymakers. And that's what we did, because it gave us an opportunity to speak directly to these folks. We also probably distributed materials, and we probably also, in that, garnered media and leadership teams on the behalf of other community members. So that's an example of what the activity might be. And then on the second page, I'd mentioned that in that activity, we invited the daily news reporter to that meeting, and in the box, we would basically state that the outlet was the Daily News. The date of the placement was 6/20, and then the type was newspaper story. See the drop down there, you get the choices. And then we provide a link, so you could provide a link to that story. The nice thing about newspaper, and I would encourage you to go ahead, and especially if you have a link, no matter what the type of media it is, The nice thing, if you have a link, put it in as much as you want. We can evaluate because there's a link. We can look at the story ourselves and say that's a really good story. That's a really good link, or that's really. It doesn't matter. Do as best you can on that. So another example, and this one I'll do a little bit different. We'll look at, let's say we're talking about healthy vending. So we did a very similar thing. We invite a TV reporting to a sponsored workshop by the leadership team on healthy vending. And after that, and we would report after that meeting, the TV reporter interviewed members of the leadership team after the workshop. So then we would report the outlet would be the TV station, the date that the TV station aired the story, and of course it would be a TV story, and then you could also add a link there. I think that's pretty self-explanatory. It looks like we have some additional questions. Are you limited to how much information you can place in the box where you describe the recruitment activities? Right here, limited to 300 words. So you got quite a bit. So you might want to, you could bullet things if you had a lot of activity. You could bullet things, and then start acting. And we'll see the connections as you make because those connections will be easily made as you go through. Because my guess is that this, and you'll see this in some of the examples, that some of the activity here in this report will generate reporting activities both in the education of policymakers and advocacy with organizational decision makers. Okay, now we'll move on. Maybe we'll move on to advocacy with organizational decision makers. So this report allows the grantee to report on the core leadership team's efforts to advocate with business and other organizational leaders. These activities should be reported when a grantee is working toward organizational level policy or systems change, and you have engaged key decision makers with that organization. Do not report efforts to merely recruit new coalition members in this report. This is about engaging and advocating with an organizational decision maker. So basically, this is an activity of the leadership team. And at the end, we'll talk a little bit about how we might try to ensure that this stuff is captured. So to complete this report, you'll enter the date, identify the name of the organization, briefly describe the meeting, and check the box that best describes the nature of the conversation with the decision maker. So an example might be, I'll use healthy vending this time. Let's say healthy vending is in public venues is your policy priority area. So you'd have a date, enter the date, which is pretty easy. You got a date there, and on this particular example, I said the 10th. So on the 10th, we ended up meeting with the library director. So you'd place the library director in this area here. And then basically you met with the library director after the leadership team sponsored the workshop on healthy vending. So you had an earlier event, which you probably described earlier, and you brought in someone to talk about healthy vending. The library director was there, and so you describe that in the description. And then below here, you select the category which best describes the nature of your conversation with this organizational decision maker. With this one, the library director came. The library director was fired up. She or he is going to go back to her organization, and they're going to obtain a commitment on a healthy vending policy in the library, so that there will be healthy vending available to the patrons and the staff of the library. So that's a pretty specific example. Actually, I think the next two sections are pretty easy and because it is around you directly engaging an organizational decision maker. So another one might be, we'll go back to the complete streets. So in the complete streets example I mentioned earlier, or we can call this active transportation as well. We had convened people, and we invited the chamber exec, who also ended up being a demonstration of how we mobilize. So the chamber exec was there, and at Fred Walkabout's presentation on active transportation or complete streets, and he talked about how to attract young professionals and how this will bolster economic development in the community. So basically, it was in this particular case, it was the ED of the chamber, and he attended the meeting. We talked about the economic development about that, and what we did was we educated him about policy solutions around complete streets. So in his case, we educated him about policy solutions, or we also educated him about the issue itself. So there's two examples of advocating with organizational decision makers. Now we'll move on to government policymakers. So this report allows the grantee to report the core leadership team's efforts to educate government policymakers about issues related to policy priorities. Activities funded by KHF, we cannot, this is one, and I'll talk about this as you go look at the reporting form. So if we are funding the activities, if your time is being funded by us, you cannot lobby for specific legislation. So we're not going to ask you to report on any lobbying activities. We're just want you to report on education activities. So to complete this report, you enter the date of the meeting, and again, there's a drop down there. The topic, an example of that might be, again, we'll go back to complete streets or active transportation, and again, we can say active transportation and economic development might be the meeting topic, and it was probably the date that we brought in Mr. Walkabout, and he was we invited policymakers, and we can state specifically who that policymaker is. It's probably, in our example here I wrote down, was Mary Smith, City Council, and she was really fired up about it. So we gave that she really thought, you know, this is great. If we had a more walkable, bikeable community, we're going to attract more businesses, and that's going to increase our tax base and keep our city thriving. And so you could, you had conversation with her about that, and you can report that as a 4 in your perceived success. So this is really important. So all we want is the topic. We want to know who was involved, and we want to know your perception of the success of that particular meeting. So we're not asking you, did she say she's going to go back and vote or create policies? We're not asking you to say she committed to a policy change. We're just asking you to your perception of the success of that particular meeting. We can also look at, as another example, we could look at safe routes to school. If I can find my, oh, here we go. Let's switch to healthy vending again. We'll stay consistent. So healthy vending, as you recall, we had used healthy vending. We had brought in, the leadership team brought in some had a workshop, and we invited not only the TV reporter, but we also invited Jerry Jones, who's the city council. So we would put the date, and that was the 10th, and we brought in, you can describe the meeting and the topic of the meeting. It was healthy vending, and it was Jerry Jones, and he wasn't really that enthused, but he wasn't really negative about it either, so we're going to say, that's maybe a 3 on the success of that meeting. So there's some examples around specific policy areas that I think that's what we're looking for. Do we have any questions to this point? So after you've filled out you're able to review it.
And the review page just takes you through every single question that was on the individual pages. So it's one full page of all the 6 previous pages, so you can look over it. And then at the very bottom will be your submit button where you'll submit the report to the foundation.
Rather long.
Yes.
Carolyn was here, so you're getting dizzy.
And like Jeff said, not all of the 10 lines have to be filled out for each page. Just as much as you have to fill out is sufficient.
But I think it's important to think about when you do activities, and we've talked about this before. Some of the examples here, you can see that we had, in two cases, we had 2 convenings, or we may even, it may just be a meeting too, with an organizational leader or a policymaker. You could do multiple entries on these as you do different activities in your community. So are there any questions regarding that? This is really, hopefully this is going to be easy for you. One of the things that we've talked about in the leadership and the TA team is going to help help you try to figure out a structure for you to capture these. So as your leadership team meets, we think it would be real important to figure out how you would create a standing agenda. We know that your leadership team is working on a lot of other things. So with that, I'm taking off my Kansas Health Foundation hat. In fact, Elissa's even taken over the controls of the webinar right now from you, and I'm going to talk about my experience just recently around, I think, was a lost opportunity. And it was because I didn't think about it, and we as a leadership team really didn't even think about how an activity that just happened this weekend could have really helped us fill in this particular form around an activity. So I'm on the leadership team of the Health and Wellness Coalition here in Wichita. We've received a community transformation grant, and one of the things that as a result of that, is we have significant funds to do a media campaign, basically a campaign, a broad campaign, and it's Fit Wichita, and we've kicked that off this week, and we had an event. It was a Fit Festival. It was in Sedgwick County Park, and Mem Wilkie, who chairs the leadership team, asked the leadership team members if they would volunteer to help with that festival. Now let me say one thing. This festival, we're going to have billboards, we'll have TV, radio spots. So there's going to be a lot of talk around this campaign. The campaign, though, is not focused on policy. So we actually had conversation with the leadership team around how that might help us. It's going to be visible, but it's really focused more on how individuals can become more fit, how they can become more inspired, and how they can taste. It's really fit is fitness, inspiration, and taste. That healthy food can be tasteful, but it's really focused on individuals and having individuals think about where in their environment they can be healthy. So it's really focused on that. So how do we as a leadership team turn that around? And I thought about this waking up in the middle of the night tonight, where I was laying in bed and I volunteered to be part of this Fit Festival. I was in charge of the bikes. We had kind of a competition. It wasn't really a competition, but we had kids and families going through different stages, and I was on bikes, and I'm timing them on a minute on a stationary bike. And we're outdoors, there's music playing, and there's a bunch of activity. But what we did is we invited a lot of people to this event, and at that event we had the local reporter from the Wichita Eagle, we had the television reporter there, we had a radio there, we had these activities that people were preparing for. But while I was there was a lot of downtime, and the reporter came over and started chatting with me. And I woke up this morning and thought to myself, you know, if we at the leadership team would have thought about what's happening in our community that we basically are initiating, or what activities are we going to be involved in, and how might we develop talking points to engage those people that are coming to these events and have a conversation with them about it. So Wichita's leadership priority is a publicly appointed food policy council. So I could have actually started, because the reporter comes up to me, I know him from way back, and we start chatting. And you know, it's just kind of small talk. But I could have at that time, and I probably should have, said, you know, this is sponsored by the Health and Wellness Coalition. You know, we have a lot of activity going on. There's as you can see, we've been promoting healthy behaviors around walkability and bikeability. But right now, we're really focused on developing a food policy council. And so I actually, in my mind, was trying to think about, gosh, if I would have had some talking points about a provocative statement about what would happen if we, you know, if somehow locally something happened dramatically and we had to feed the population with the food we have today, we can't do it. So if I had some kind of talking points, I could have engaged him and said, you know, Bill, we're really thinking a food policy council would be great here in Wichita to really delve into some policy issues around access to healthy foods, around food deserts, around how we grow healthy foods, and how we might produce more healthier fruits and vegetables in the community, and how we might, all those kinds of things. And I could have had that conversation with Bill. There was a story in the paper about the Fit Fest. It didn't talk about the Food Policy Council, but if I would have had that conversation, I don't know that he would have written about the Food Policy Council, but I would have planted in his ear, the notion that we're working on this with this Health and Wellness Coalition. I could have directed him to the person who's also serving on a leadership team, who's kind of overseeing, is part of the committee that's investigating that for the coalition, and told him to talk to her about it, and it could have, or it may in the future, generate a future story that we could then report. But we certainly could have reported it on how we educated him. It could have been it was part of that education piece, part of advocating or engaging him in that conversation. But it certainly wouldn't have generated a report at this time, but maybe in the future we could have. And plus I would have established a relationship with this topic with him, and could have even said, let's have lunch, let's do something like that. So I say that because I think that we want to make this easy for you to do. And we could have actually had a conversation with Mim about this morning, and we could have actually, before this meeting, we met just a couple weeks ago, we could have said, you know, we're having the Fit Fest. I know that I think 6 or 7 of the leadership team was there. You know, what are the opportunities we're going to have conversations with reporters? There were other city council members there. There were policymakers there. We could have created that opportunity to have conversations. With that, do we have any questions? Doesn't look like we have any questions. We're going to be available to answer those questions. The leadership team, well, not the leadership, the technical assistance team would be happy to work with you on this. We do hope that you can come to a kind of a decision point around your policy priorities so you can start reporting on this specifically. Again, we don't want you giving up any of the other work that you're doing. We know that communities are doing work around in different areas, and there's energy, and because we read about it in these contact logs that we're capturing on a monthly basis. So again, feel free to connect with your technical assistance providers, and at Center for Community Support and Research and Healthy Kids Challenge. Public Health Law Center is going to be available, and feel free at any time to contact me if you have any questions, and we can talk through and work through some of these issues if you're having challenges. So with that, I think we'll turn it off unless we have other questions. Okay. Thanks for being on part of the webinar. Take care.